Hey guys, I'm Combat Craig, and today we're talking about VA claims for sleep disorders. Mainly, we're going to be talking about VA claims for insomnia, narcolepsy, and sleep apnea. And today I have Kelly with me, who's a sleep disorder specialist. Hello.
Hi, how are you?
I'm doing pretty good. You ready to talk about some sleep disorders? All right, I'd like to start with VA ratings for insomnia, and I just wanted to kind of preface it with a few things. Then you could tell us about insomnia, but from a rating perspective, this is about Veterans Benefits Administration benefits. Uh, you have to have a strategy, come up with a plan, get my boot camp. If you need medical evidence, there's a link in the description for that too. Insomnia doesn't actually have a rating in VA world. And typically it's a mental health symptom and a pretty low one. And that's kind of what we're going to talk about. So, what do you know about insomnia? What can you tell us?
Insomnia actually is the number one sleep disorder, believe it or not. Insomnia is either the inability to fall asleep or the inability to maintain your sleep, or you can have both. So you can have a hard time falling asleep. You can wake up in the middle of the night and you can't get back to sleep. But usually there's some underlying cause to your insomnia. And the idea would be to figure out what it is. It could be very short term or it could be very chronic and long term. And we talk about the VA ratings as far as insomnia goes. Sometimes there's a mental health component to it. And, really getting to the crux of what or when it possibly even started. Because something must have started the insomnia to happen. Is there, I always say to patients, is there a sickness in the family? Did you lose a loved one? Are you stressed about school? There's something that has caused it. So when you're talking about insomnia symptoms, again, you want to go back to what is the underlying cause. And for the VA and the ratings, this is a conversation again you want to have with your provider and really have a conversation. It's not just, hey, I have insomnia and I can't sleep, give me something to fix it. Let's figure out where the underlying cause is. So, do you have depression? Are you suffering and thinking about, suicidal ideation? Are is this stuff that's interfering with your daily routine? The thing is with mental health and insomnia is they're bidirectional. Your insomnia can make your mental health worse. Mental health issues can cause your insomnia to be worse. So the idea would be to really have that conversation, honest conversation with your provider about what is really going on. Over time, insomnia is really going to cause more, problems with your everyday, dealing with your everyday life, because we all know that whatever's not going well with when you're sleeping, and we're going to talk about sleep apnea later. Anything that's not going well with while you're sleeping is going to affect your overall health during your waking time in your life.
VA claims are all about strategy. I preach and I teach strategy in my boot camp. Check it out at combatcraig.com. Yeah, that makes sense. And like insomnia is something just in my own experience. Like, oh, I have insomnia. I've had it for a long time. Like, oh, I have insomnia. I didn't sleep or I don't sleep or like it's you can't self-diagnose yourself with anything, but like that's such a common term that people understand what you're talking about and whatever. I didn't sleep. I have insomnia. Oh, me too. Again, don't do that when you're trying to file a claim. Get a doctor to do it. But then you look at a word like I'm feeling depressed. That's that's different. Like feeling depressed. So are you sad? Are you diagnosed with major depressive disorder? So a little bit different with insomnia, depression. I'm feeling like I'm stressed or anxiety. All these things feed into it, and make sure you figure out what it is. And for VA rating purposes, we're going to talk about the criteria in the 70% mental health category. And I'll show you why insomnia alone usually ends up at 30. Not saying that people don't get higher ratings. It's just typically you get 30 because you don't have the symptoms. It comes down to social and occupational impairment. What do you think about going through some symptoms?
Sure, we can go through some symptoms. These are
Um,
things again that are going to affect your life. And, your provider probably is going to ask you questions such as, have you had any thoughts of suicide?
Yeah,
And if your answer is
suicidal
yes, then
ideation's a good one. Like, I mean, I guess technically I have insomnia and I mean, I'm sure it's happened, but major depressive disorder fits in there a lot better, or PTSD or anxiety or one of the other 150 conditions other than insomnia. So
sure.
look for
And
the
even that,
underlying condition because there probably is one. If you have suicidal ideation and you only have a
sure.
diagnosis of insomnia, you have more stuff going on. Is most likely what's going
Oh,
on.
for sure. And just because you have suicidal ideation doesn't mean you might not carry it out, but the thoughts of something like that, that's a big red flag for sure.
Absolutely.
Are there, yes, are there any obsessive, things that you're doing that are interfering with,
Daily
your normal
activities, obsessive
daily
rituals,
activities?
checking the
Mm-hmm.
locks, checking the cameras too
Washing your
much.
hands.
Yep. So for me,
Yep.
those things are kind of in both the anxiety and the depression. My hypervigilance stuff, and I definitely wouldn't attribute that to insomnia. It could be a little bit there, but for sure, I know I don't know how it goes there, but I understand, and I'm diagnosed with other mental health conditions, and they fit in better there.
Well, it's true. And then, that other one that I know is on the list is about maybe thinking illogically, having different things going on with your speech. Maybe you're not getting all your words out like you're supposed to. And that insomnia, if you experience insomnia night after night after night, how much sleep are you actually getting? And it is going to impair your thoughts, and it's going to impair a lot of what's going on, during the day. How are you going to function? We all know when we don't get a good night of sleep and we're at work during the day, we have a hard time focusing just sitting at our desk. So if you're somebody who, like, again, has insomnia and you're only getting 3 to 4 hours of sleep, maybe some people aren't sleeping, what is that doing to your overall, you know, thoughts, activities? Are you more irritable? We know we're super irritable. Is it going to cause more of an impulse um, mechanism to have a reaction that might not be a very good one?
It's kind of funny. You're kind of selling me on that because it's like, yeah, I totally have uncontrollable road rage. The best solution isn't what I do, which is don't drive and try to avoid people. But insomnia could cause that. It can cause a lot
Sure,
of
it
these
can.
things. Yeah, yeah, you're right. It does tie in, which I guess to the bigger picture, especially coming down to ratings. There's probably other stuff going on. So go see a board certified psychologist or psychiatrist, but probably a psychologist, and get a diagnosis, find out what's going on.
It might even be your best friend or your partner who I know one of the things on the list is, you're not taking really good care of yourself. Your hygiene starts to wane. You're not getting out of bed. You're staying in bed all day long. You're not the person who's getting up to brush their hair or to put on your clothes even. There's some people who will lay around in bed all day, sleep all day. That's a good sign that, there's a depression underlying cause.
There are two times when you don't need a nexus: when you file a claim while you're still on active duty, like a BDD claim, or when you're in the 1 year presumptive period. Any other time, you need a nexus. You also need a strategy. Check out my boot camp and contact my med team if you need a nexus.
Leading to that insomnia. You're not sleeping all night long, so we're just going to lay in bed all day long and not care about ourselves.
In my case, just a completely separate thing is chronic fatigue syndrome. That hits me and I'm like that, and then the depression kicks in. So there's different things, but yep, it is insomnia can be there for sure. If you can't sleep, you can't really do any of this thing. You don't really care about how you look, how your relationships are, going to work, having a wife, being a good, mother, father, brother, sister, whatever. You're probably having problems all over the place. But I think you're probably having some other mental health issues as well.
Right. And it's going to be taken out on all the people who are closest to you. And they're probably the ones who are going to bring it to your attention. But it's up to that individual to want to do something about it. And that's why in these cases where mental health is potentially involved into an insomnia case, you definitely want to go have a conversation with your provider. Because like we said, insomnia alone is not anything as far as a VA rating until you actually go see your provider and maybe find out what the underlying cause is.
Yeah, and you brought up another good point. It is good to just kind of switching gears, buddy letters, lay evidence, lay statements. Getting a buddy letter from your wife to explain that is good, but that is not a substitute for actual diagnosis. A lot of people are unclear on that. Self diagnosing yourself when you're not a doctor or having your wife do it is not an actual diagnosis. You're actually going to a CNP exam for insomnia and you're going to see a doctor. And he's going to be like, oh, that's cute. You diagnosed yourself. Oh, look how cute. Your wife did it too. Yeah, I don't think so. I mean, he may diagnose you, but he'll probably just be like, yeah, I don't think so. Go get a real diagnosis.
Right. And I think it's hard. A lot of people who experience these issues don't necessarily want to talk about them either. So that's why you need that significant other, your buddy to say, "Hey, something's going on with you." And it's hard for individuals, I think, who are experiencing mental health issues, like I said, to own it. I know mental health has become something that's more awareness to mental health these days, and that the stigma hopefully is not as bad as it once was because there's so much more focus on it, and especially how it relates to sleep.
Yes, I agree. There is more awareness on it, and just I've really gone through this after whatever I was 50 when I got real with myself about mental health and the strangeness. There is nothing. It's embarrassing having suicidal ideation or being anywhere in that bucket, and you need to be able to go talk about that in front of a doctor, like to get a diagnosis and at your CNP exam. So you need to talk about it, and you should probably talk about it with your spouse and your kids. And when you're the dad and you're the rock and all that stuff, and you're talking about that stuff, it's a hard conversation, but have it because it'll definitely make your life longer, I think.
Sure, and then it'll remove some of that stress that's going on I'm sure in the household because of it.
Yeah, people understand maybe what you're going through. I don't know. I don't know if it's going to fix it, but if people are more aware of what you're carrying and maybe why you're carrying it, yeah, they might. Okay, this is why he does
And I would
this and that.
imagine, here we're just regular lay people, going through our day to day, but we're talking about, veterans. We're talking about people who served in the military, whose experiences are far different than anything I've experienced or ever seen. So things like that live with you for a long time. And having to be able to talk to them, having to be able to talk about it would be helpful.
Yep, I agree. All right. Well, I think that does a wrap up on the insomnia. How about we hop over to VA ratings for narcolepsy? And this one's really fascinating. And I will let you go in. But again, as insomnia doesn't actually have a rating, they analogously rate it with mental health. With narcolepsy, they analogously rate it with epilepsy, which is kind of weird because I don't really know too much about either one of them. But what do you have to say about this one? Just narcolepsy in general and how the VA has decided to throw it up on the board.
Sure. Narcolepsy is one of those interesting sleep disorders. It's something that either you see a lot of at one time or you don't see anything for a long time. So narcolepsy usually shows itself between the ages of 18 and 26 years old. And there can be people can have symptoms where they just have sleep attacks in the middle of the day. Narcolepsy is when your dream sleep intrudes your wakefulness. So, when you're dreaming, your body's paralyzed. So, like I said, when these sleep attacks happen, these dream stages pop in your day and you have a momentary little nap in the middle of the day. You wake up after it, actually feel more refreshed. But these sleep attacks can happen more than once during the day.
If you've reviewed all the medical evidence and you know you're missing something to establish service connection, like a diagnosis or a nexus, you might want to check out my med team. There's a link in the description. They can help you with your missing medical evidence.
You also can have something called cataplexy. Cataplexy is a symptom of narcolepsy where a strong emotion can cause weakness. So some people might be with a group of friends, they start laughing and your legs go weak and you could collapse, or you might experience a facial droop, or you could have an arm, droop. It could be very subtle. It could be very prominent. I've heard stories where, like, kids in college, there might be a kid who's got narcolepsy and his friends all get together and all tell jokes to see if they can get the kid with the narcolepsy to have a cataplexy attack. It doesn't happen for everybody, but it can happen. In fact, there's a couple different types of narcolepsy. You can have narcolepsy, like I said, with this cataplexy or without the cataplexy. Some people will experience hallucinations when they sleep. They'll be paralyzed, even they have sleep paralysis. They'll be paralyzed because they're still in their dream stage sleep, and they'll still somehow be between sleep and wakefulness and stuck in that space. So you could be almost experiencing a nightmare, but you're paralyzed, yet you're awake and it's happening. Or there's things called hypnopompic and hypnagogic hallucinations that can happen as well. Now, you don't have to have any of these. You could have a couple of these symptoms along with narcolepsy, but truly, this is diagnosed through a sleep study. And some of the things we look for when we do patients do sleep studies on patients who have narcolepsy is that we need a sleep diary to show what is your sleep pattern for 2 weeks at least. We want to know that you're getting at least 7 to 8 hours of sleep nightly, because obviously if you're not, what's going to happen? You're tired during the day. Like we just talked about insomnia and having to take naps during the day. So you want to make sure you're getting adequate sleep. What are your habits? What are your nighttime habits? Is there something that's causing you to not get good sleep or have this happen? And then after you would spend the night in a sleep study to make sure it's not sleep apnea, you don't have insomnia, we see that you're sleeping, you stay for a series of nap tests during the day. And what we're looking for is when we do these naps at every 2 hour intervals, are you able to fall asleep? And if you do you go into dream sleep? And we're looking for 2 naps where you actually go into dream sleep in order for you to have a diagnosis of narcolepsy. Some
Oh,
people, because they've disrupted sleep stages too, I'll throw this out there. Some people can go to sleep like most normal people. They fall asleep and they go through the normal stages. A person who's got narcolepsy, their first stage of sleep might be dream sleep right when they go to sleep.
right. So it's completely different. I was thinking, and you kind of touched on it. When I did my sleep study, it was for sleep apnea. So it was go at night and all the probes and all that kind of stuff. So this is a different kind of sleep study. You'll get the sleep apnea one too to rule that out. But yeah, now you're coming in for day
Yeah,
tests and nap tests. And yeah, what standing there, or what do you just fall asleep and go straight into deep sleep? And yeah, like you were kind of saying, that's interesting. You could actually be pretty rested after one of these episodes when your jackass friends trigger you into doing this. Like, yeah, that was real cute. You made me do whatever, but at least I'm rested and you guys aren't. Kind of weird. This is a tough one.
I have seen patients, typically if we're even going to test it, sometimes people have come from their doctor who put them on some sort of stimulant medication. And so anybody who goes for a narcolepsy test has to be off any stimulating or sedating medications before they come in. A lot of people don't like to go off their Adderall or whatever else that they might be taking because it helps them stay awake. But truly, to test for this, you need to be off anything that's going to skew the daytime test where we do these naps. Same with if you come in for a narcolepsy test and we find that you have sleep apnea that night before, depending on what your apnea looks like, we'll be canceling this test. We're gonna have to treat that apnea first because you can have sleep apnea and you can have narcolepsy at the same time. But we need to treat one before we're able to treat the other.
Brings up a good, just another topic. I
Mm-hmm.
wonder if you could have ratings for both. My, it, I'm going to go with yes, because narcolepsy is one thing over here in seizure world, or epilepsy, right? And then sleep apnea is,
Right.
because sleep apnea it's a respiratory condition. It's a neurological or convulsive
Oh,
disorder. So they are
convulsive
different. So you
disorder.
could probably have, a high rating depending on, what's going on with the seizure situation and sleep apnea. So yeah,
Sure.
not only do you want to find out for yourself, but that could help your claim as well.
I have heard where narcolepsy can start as early as 13 years old. Sometimes you find it even in certain groups of nationalities. I did meet a doctor who had quite a few patients with narcolepsy in his practice, and they were of a non-American descent. So I think there are populations of people where this genetically can be found in more than other places also.
So I have an interesting question. So you mentioned ADHD. I didn't even actually get a diagnosis to that till in my 40s. For me, it just wasn't something we were looking for, and I don't know what handing out Ritalin or Adderall or whatever it was for kids. You're saying narcolepsy is usually found younger too. Let's go down both rabbit holes. What are your thoughts on how many adults actually have ADHD when they should have been diagnosed when they were a child or whatever? And the same with narcolepsy. Does that happen in adults, I guess, is the question.
Sure. Absolutely it can. And I know I've met people who are getting diagnosed with narcolepsy older, and they talk about how they're able to compensate for it because they were able to take naps to be able to get through the day, because those naps ended up being refreshing and helped them through. Whereas I will also see the flip side of that, where I'll see patients come in for a diagnosis of narcolepsy, and it's 9 out of 10 times it's really not a narcolepsy. It's some underlying other issue. People are not sleeping. People want a quick fix for certain things, like you said, like the ADHD thing. That's why you have to be off all those stimulating or sedating medications to really find out about this diagnosis. So, yes, you can have somebody who is diagnosed later with ADHD for sure. And then there's that other thing with restless legs we're going to talk about at some point, and how that even plays into, again, having a not being able to focus. Because a lot of what these issues are, people cannot focus. You're too tired. We see this with kids all the time. You're tired or not sleeping well, so you act out during the day. And so people mistake that as you have attention deficit disorder when really you're probably just sleepy.
Let's go down that one. So are we talking about restless leg syndrome versus, is it called periodic leg movement? Is that what it
So
is?
restless legs is a disorder of wakefulness. People are always constantly moving their legs. They feel like they have this itchy, crawly feeling. Jiggers, got to move them, that kind of thing. Periodic leg movements are what happen when you're sleeping at night. We'll see it on a sleep study. We monitor your leg movements, and we'll see actually this muscle jerk, muscle movement. It could be very slight. I've seen crazy wide leg movements as well, but it's those leg movements that'll cause your brain to arouse. You're not aware of it because you're sleeping through it. But all those arousals, same with sleep apnea. It's not the apnea that makes you sleepy, it's the arousals to your brain. So for some people, they don't have arousals to their brain. We just let those PLMs happen. The people who have arousals happen throughout the night, those are the ones we're going to want to treat.
And I caught an acronym there, PLMs. PLM apostrophe S, periodic leg movements. Just wanted to clarify
LMSs,
that.
yeah. PLMs, RLS.
Yes. All right. Cool. Let's hop into the third, the third thing that falls under sleep disorders that the VA rates is sleep apnea. And just to kind of start off, we did a pretty in-depth video probably about a week ago. Are you not in my boot camp yet? This is the easiest way that I know to teach you to win your VA claim. Links in the description, combatcraig.com. I'll put it up here somewhere so you can look at the thumbnail to go deeper, so we won't go too deep into it. But I'll let you take it from here.
Oh, sleep apnea. Okay, everybody. I think everybody's got sleep apnea. Go get a test. Sleep apnea is when you go to sleep at night and it's that soft palate in the back of your throat, your tongue, and all that kind of stuff just relaxes, and you're going to sleep at night and it falls back, cutting off that air supply. Um, Apnea is the absence of breathing. And there's something called hypopneas, which is underbreathing. So again, I tell people if I see a nice wave pattern for breathing, that's great. If I see it flat and you're not breathing, if I see those wave patterns decrease, you're underbreathing. That's a hypopnea. But anytime that happens, heart slows down usually, pulse oximeter you're wearing at night drops, and we're going to watch a lot of chronic conditions happen if you don't get that thing fixed. So the VA ratings for having sleep apnea, this is why you want to go get it diagnosed, because we talked about this before. You can have what was it? Was sleepiness without having a sleep disorder? But I'm
Yeah,
thinking,
0% rating is asymptomatic, but with documented sleep disorder breathing.
okay, so I'm thinking asymptomatic is possibly even just plain old snoring. You don't have any symptoms.
Right.
Maybe you're just a mild snorer and you don't have any symptoms and no apnea. It's not really bothering your bed partner, so we'll just let you sleep, snore a little. But eventually, as you get older and your tissues get a little little more aged, sometimes that snoring turns into more upper airways disease, syndromes where snoring gets greater. We know when we're awake during the day, the air you're breathing right now is not the same air you're breathing when you're sleeping at night. There's more resistance to it. So, meaning, the air that goes up through your nose, if you're a nose breather, those nasal passages become narrower, so less air gets in. If you're the mouth breather, like I said, your soft palate, your tongue falls back, so you're going to wake up with that dry mouth. That uvula on the back of your throat might be bruised. You'll have headaches. Maybe the person who gets up frequently to go to the bathroom in the middle of the night, these are all definitely symptoms of having sleep apnea. So definitely need to go talk to somebody about that. Um, if you are diagnosed with sleep apnea and you get a CPAP machine, we know that's a 50% rating right off the bat.
Right.
Having to have a CPAP machine. And then, certainly if you're more diseased and in chronic respiratory failure or congestive heart failure, definitely that's going to be more of a 100% rating
Yep.
because that's more severe. And then we talk about sleep apnea, but what about central sleep apnea? That's when your brain doesn't signal you to breathe. So that's another one. And mixed is when you have a combination of both. You can have obstructive apnea and mixed apneas or central sleep
Central
apneas.
and obstructive. And I
Yes.
want to point out something here that in case you kids are not paying attention on a point, I bring it back to money always. So these are three different things. These are the different sleep disorders. So insomnia is one thing, a mental health condition. You probably have more. Get it diagnosed, get better, and get the rating, a 70% rating. Narcolepsy falls into a different neurological bucket, but you can get a rating. They have ratings that go from 0 to 100 there as well. So you could have both of those with no pyramiding issues. And you could also have a sleep apnea rating, which is a respiratory condition. So you could actually pick up ratings in all three of these categories. And if you have a diagnosis for one of these things and another one that's not service connected yet, all of these would probably fit together as secondaries as well. What do you think?
For sure. Absolutely. I know that there is documentation. I want to say recent documentation. I was looking some stuff up that definitely PTSD and sleep apnea are really going hand in hand. I've even seen a recent study. I want to say as recent as possibly even this year. So we can talk about that at a later date.
Yeah, we'll do that one, and we'll do that one in a different video. More to come. As usual, Kelly, I like that. I like you coming down and breaking down what all these big medical terms are and stuff, and break it down Barney style for us. So, thanks for joining us, and we'll see you in the next video.
Great. Thanks for having me. Have a good
Bye.
night.